Welcome to the FCTV podcast. I'm here with Tom Kamber. He is the founder and executive director of Older Adults Technology Services from AARP, better known as OATS. Tom also created the Senior Planet program, which helps older adults learn digital skills, connect online, and feel more confident using technology. What started as one small program in Brooklyn has grown into a nationwide effort, helping hundreds of thousands of older Americans stay connected and engaged. Tom, welcome to FCTV. I'm so happy that you're here.
Thanks for having me. I'm excited to do this.
Yeah. So let's just jump right into it. How do you think broadband has changed the day-to-day lives of older Americans?
I mean, I've been doing this work now for over 20 years, and the transformation for older people is really quite profound. I think what happened is that we started adding a lot of years to the human lifespan somewhere in the middle part of the century. And so people are now living into their 70s and 80s and even 90s. And so as older people are having all of this extra sort of lifespan and even health span, they're more active, they're more engaged, they're able to work longer, they're able to be more social. Broadband has kind of emerged around the same period. And so there's been this wonderful interaction effect of aging and technology. And people are using it for what you would expect in the main things in terms of communication and entertainment and research and accessing their resources and medical supports and things. But it's really helped older people sort of reshape and reframe their later years and be more inventive and creative about some of these patterns of aging. So, I'm here.
Give me some examples. Well, what are people doing?
I mean, the big changes. First of all, a lot of folks, of course, are continuing to work a little bit later. So, people who want to stay relevant and competitive in the workplace are using broadband as a way of sort of keeping their skills sharp. Of course, now because we have hybrid and remote work, many older adults are working from home or using that to supplement their incomes. People are managing their finances. They're doing online banking with the resources that are available. But of course, for many people, as you retire, you have to rebuild your social networks. So people have been using the social media sites, which are not so great for our teenagers, but are quite good for our older adult family members and friends. They tend to be more socially connecting for people. And now people, of course, are using AI for the more advanced research and applications for things like creative expression and writing and building. Even a lot of I have a gentleman I've worked with in Manhattan recently who has a condo association, and he's on the board of the condo association, and they had to rewrite the bylaws. And so he went out and went online and got, using his broadband and got on one of the AI tools and rewrote the bylaws for his condo association, and then ran them by a lawyer who said, "Oh, these are perfect. We don't need to make any changes at all." So it's really empowering people to use the technology for independence as well.
Yeah, and you mentioned healthcare aside from just like telehealth, like how is broadband sort of enhancing healthcare for older adults?
Well, the biggest changes have been, first of all, the patient portals are a really profound opportunity for people. When I started this program in 2004, they were just introducing things like, MyChart and programs like that. But now 60% of older people have access to a patient portal and are using it. So first of all, they're actually much more efficient in making appointments and communicating with their providers and managing medication. So those are really important areas. And then there's really been an empowerment of older people as consumers of healthcare information. So now there's a thing called the patient activation measure, which is a test of how efficacious a patient feels when they're using healthcare information. And it assumes that the person knows things like, what do your medications do? We all have a bunch of pill boxes and we're taking the bills on our schedule, but many people have forgotten, is this one for high blood pressure or for different conditions I may have? And for older people, it's really important to look at your medications and list them and compare them to each other, because some of them have bad effects around things like balance and falls. And so managing that information, then going to your doctor and asking, is this the right mix of medications? Should I be using something that's more appropriate for somebody my age? Those sorts of things are now really making a big difference.
That's interesting. It sounds great, and I see how this could work where, it empowers people, right? Because as much as we all love our doctors, potentially, right? In this era of managed care, you don't get very long with your doctor. It seems like maybe some things are overlooked or missed, or certain people are prescribing things and there's not a lot of coordination. And so you really have to be your own advocate.
Right.
And this seems like a great way to do it, right?
I love my doctor. Hello, Dr. Fahumanji.
Right.
It is very important that we become more empowered. In fact, the statistics show that when patients are learning to ask questions and becoming more informed, not that they're doing it without the doctor. We're not talking
Right.
about like Dr. Google or something. That's not the right way to do it. But using that information to supplement what you're getting with your doctor so that time is better used. They find that if a patient asks one question during their doctor visit, they're more likely to have positive health outcomes. Just
Wow.
showing up with that a little bit of empowerment, a little bit of curiosity, and a little bit of confidence that the technology is an asset and a friend to us as we use that, again, with the doctor in the loop, but just empowering us to be more activated with it.
Yeah. I can definitely see that being important. Let's talk about the future, right? So, everybody here is talking about AI. And some other future technologies, automation, robots, that kind of thing. How do you think like some of these futuristic technologies are going to benefit and help older Americans, especially folks who, maybe, for example, are like trying to stay in their homes? Like, can we leverage this technology to allow older Americans to age in place?
Absolutely. I mean, there's just three quick examples. VR, which is still out there and people are still using.
VR, people still. It's not just for games.
Like last century's technology.
Right.
But for a lot of older folks, they may have limited mobility. They may have limited opportunities to, travel or go places or even if you live in a tiny little apartment, you put on your VR headset and it suddenly makes it feel like you're in this wonderful, beautiful suite, right?
Yeah.
And so people are still using VR. By the way, huge numbers of older people are gaming. So this notion,
Really?
a significant. I think it's 30% of gaming is now done.
Are
by
they
older
on
people.
Fortnite? I mean, that's crazy.
They're gaming on a lot of different platforms, but it's
Okay.
quite popular and has been forever. It's something
Wow.
that's kind of been under the radar. And then I think AI is obviously changing how people are living in very important ways. I think it's allowing. We just recently did a caregiver study, and one of the things that came back loud and clear from people is they are overwhelmed with the paperwork. They're just getting killed with all of the documentation and the follow-up and the timing and the scheduling and things. And what all those challenges for the caregivers and the older people that are often participating in their own care is it's an information overload challenge. And so AI is allowing people to just package and sort through and kind of jump through those hoops a lot faster without the person necessarily needing a PhD.
So like having an
organizational
assistant
science. Yeah.
to help keep you organized.
That's right.
Yeah.
It's that kind of personal digital assistant. That's a term going back to the 80s that we all have been imagining or visualizing. But it's at the point now where it's working in a pretty effective way. Again, always with the caveats that you need to understand the technology and its limitations. And AI is still developing, and there's some things that you constantly have to double check. But it is really accelerating those processes. So living independently, for many people, you don't lose your home because you can't walk up and down the stairs. You lose your home because you couldn't get the paperwork together to keep your insurance updated or to get your mortgage payment, altered through the new bank or whatever it is you had to deal with. People become overwhelmed. They become vulnerable. They have one thing goes wrong, and that creates a cascade of negative effects on that. So AI can be used and is being used as a tool to allow people to manage that information and focus on the living at home that they want to do, the gardening and the cooking and spending time with your family instead of the giant, vat of paperwork that you're trying to wade through. And then the last thing you asked about is the future, going into the stuff that we haven't really done. I was at Consumer Electronics Show this year, and this year's obvious hot theme for everybody was robotics. There are robot, prototypes jumping around and playing basketball and
so far
and
beyond
table tennis
Roomba.
and things I mean, it's interesting. The robots that are probably most useful in the near term actually look like a Roomba. They're not all that, they don't look like anything out of Space Odyssey. But we are now starting to approximate a time when they have humanoid robots that have solved a lot of the kinetic challenges of movement, of being able to balance and hold a serving tray and open a doorknob and walk up and down stairs and pick things up and carry them, and they can jump and run. And
so now, how would that help older adults?
Well, part of it is, again, there's kind of two paths here. One path is we have a massive caregiving crisis, and older adults are isolated, and it would be helpful if we had ways to supplement what we're able to do to help people, especially, by the way, outside the United States. I mean, you're looking at countries like Japan or Spain or Italy that are rapidly aging, and particularly in Japan, they have a major workforce crisis there. So being able to bring robots into play where they can help get meals for you, they can help you carry packages, they can help people up and down stairs or around thresholds or onto the back patio or whatever it is. In many cases, that's what a caregiver does. They hold you by the arm and they sort of guide you along. They're also there looking to make sure that you don't fall, and if there's an emergency, they can respond to that. Robots are at the threshold of doing that now. And the biggest drawback, the biggest sort of obstacle historically has been the interface. The robots can't they haven't been able to interact with your facial expressions as well, or unpredictable situations. And of course, you need them to be able to do that. So there's been a kind of timeline for humanoid robots in the home. And they've been talking like 15 years, maybe, or 20 years before they were really ready for economic prime time. And now they're talking more like 10 to 15, maybe 10 years where people are starting to actually purchase these things because AI has made the interfaces so much more efficient and robust. And now the biggest challenge, which is one of the reasons we're here at Fiber Broadband Association, is connectivity. I was interviewing a futurist who works for AARP recently, who's a real expert in the future of tech and aging. And I said, what are we up against in terms of connectivity? And she said, the challenge for a lot of these innovations is people are imagining that we need a certain level of connectivity today, but if you have a humanoid robot in the home, you absolutely can't have latency because the robot is having to respond to a sort of dynamic and sometimes very high stakes situations around a person having a crisis or a person falling or something not working, and you can't have suddenly the broadband stops operating or their connection goes down and the robot freezes, and you need to be able to have like a much higher level of bandwidth for the robots to be able to communicate and get the right signals back and forth and interpret information and communicate with the networks that they're working together with in order for them to function properly. And that requires a level of speed and connectivity and robustness that is what we've built out in some places in the United States, but we still need more infrastructure on this. And I think that a lot of people haven't appreciated that the future of aging in many cases is a connected future and requires of absolutely robust national rollout of the connectivity resources that fiber broadband is providing, as well as redundancy, as well as people having the cellular and other options that are allowing them to live a really full and connected life. But we really need to invest even more in these systems than we have in the past.
Yeah, because I mean, when I think about it, so often in our society, compared to other societies, we often put aging parents and relatives in nursing homes and our system is almost built that way, right? Like that's the funding streams, Medicare and Medicaid are sort of, they direct you toward those institutions. And, I know from my own experience, I took care of my father when he was dying of cancer and he just wanted to be home.
Right.
And it was really difficult to afford, a person to stay with him, and even to find them, somebody would be good there. So, is this potentially it sounds really like futuristic and also like expensive. Is there a way you think it could drive down the cost of caring for older Americans?
That's why the question around the robotics and the commercial viability is such a critical one. I mean, the robots, and now if you have like $500,000 to spend on a robot, you can get one that'll actually be sort of helpful today.
Right.
But what we need to do is get them down to a $20,000 price point or $15,000 price point. So it's something that you would purchase, and over the course of 10 years of using it, you would get a lot of value out of it, kind of like having a second car. And it will become a viable option for a lot of middle-class families. And of course, you can imagine a scenario where people get the lower cost robots if you're not quite as wealthy, or you get secondhand robots in the future. So it is a future that you can imagine where it is commonplace that people will have one in the home to be helping out around the house and providing some support.
And also, it doesn't necessarily feel like it's taking jobs from people for the fact that we have a shortage.
That's right. Sometimes as technology advances, people shift within their job profiles for certain things. But currently, home care attendants are it's not exactly the economic wave of the future.
No, I mean, they're the lowest paid.
Right. It's not well paid at all. And so a home care attendant empowered with a robot in the house is much more efficient doing certain things. And so if you've got the robot that's doing some of the home care activities, the home care attendant can be spending more quality time with the older adult. And also, we talk about nursing homes. Like right now, nursing homes are sort of, in many cases, a last resort and kind of a sad option. Like, oh my gosh, I couldn't afford or figured out how to do this at home. But imagine a scenario in the future where robotics and a lot of our systems are more efficient, so people are able to live at home longer, and then the residential communities become the competition from the home. Will allow residential communities, which they're already doing, by the way, to start offering more. And so I visited a community in Lancaster, Pennsylvania a few years ago. A gentleman grabbed me at the table and said, people talk about aging in place and living at home when we get older. He said, that's for suckers. This is the place to be because it's so much more fun to have activities and people around me. I have so many more friends. It's amazing. I'm having the best time of my life. But it needs to be a choice.
Yeah.
And so if you're going to have the home option for people be a viable one, those residential communities will start looking more and more like this place in Pennsylvania. And so you can imagine people saying, listen, I'm going to be part-time in the residential community because I like to be there a few weekends a month, or have an apartment there, and we'll have more flexible arrangements for people. The technology will be offering us more options, and I think in the long term, more competition, which is better for providing quality services for older people.
It sounds like a college dorm for older people.
Absolutely. And I think that's where we're going. We're looking at new patterns. Those kinds of things are now possible in a way they weren't 20 years ago.
Yeah, it's super fascinating. I love that. So there are issues though, right? And one of the big issues that I've heard here and I've heard other places is affordability. So we can have all this great stuff out there, but how do we address affordability for older adults?
Well, the real challenges have been, for many people, you've got the double effect of being low income and then having lack of access to the resources that your poverty is preventing you from having. And so in this case, it's been a terrible affliction for older people to not be online. We did a survey after COVID. We did a project looking at how many older people lacked wireline internet at home using the census data. We found at that time that 42% of older Americans, people over 65, did not have a wireline connection in their home. We just updated the survey this year, and it's called Aging Connected 2025. You can find it online, Aging Connected. And we found that it's now 32%. So about 1 out of 3 older Americans doesn't have a wireline connection at home. Most of them have a mobile connection or some option, but in many cases they have nothing at all. But they certainly don't have the robust bandwidth and kind of potentially affordable connection.
But other than affordable, I was going to say there's also the digital skills, right?
So on the cost side first,
yeah.
One of the real challenges, of course, a lot of people said we can't afford it. They're on fixed incomes. They don't know the value proposition sometimes. The transition to getting the new devices and setting themselves up is kind of overwhelming. And then the cost associated with all of that becomes too much of a burden. So we were a big fan of the affordable connectivity program, and the emergency broadband benefit before that.
Which the affordability program is.
It's now over.
It's over.
It is over. And we're an affiliate of AARP. And when we joined AARP, we talked to them about the critical importance of subsidizing broadband for lower income people on the demand side. It shouldn't be something that the industry has to solve all by itself. It's something that we should have some government engagement and some industry engagement and some nonprofit engagement. It's one of those classic public-private challenges. And so AARP was on the Hill advocating for broadband subsidies as part of the groups that were saying, we need to support poor people to be able to get online. And it was really kind of a wonderful thing to see. They were able to make a difference. ACP signed up over 20 million people. It was a very popular program. We have our, fingers crossed that something will happen. Maybe they'll bring it back or, replace it with a more sustainable, affordable federal engagement. But we do think there's a need for demand side subsidy. There's also a need for building out the additional infrastructure where it still needs to be completed. And then, as you were mentioning, mentioning, what do we do about people's skills, right?
Right.
That's where we have these great public-private partnerships. So OATS, my nonprofit, runs a program called Senior Planet, which is a national training that's available for free. It's targeted at anybody. It's targeted for people over 65, but we'll serve anybody over 50. And you can come to our centers, Senior Planet centers we have in multiple cities. You can come to seniorplanet.org, which is our website. All of the programs are free. Last year, we trained 849,000 older adults who came in for the classes. We have licensing programs. It's a very robust initiative. And what we're finding is we're partnering together with groups from the fiber industry, with groups from telecommunications, companies that you've heard of. It's many of them are sitting right around us right now. We're also partnering with the Fiber Broadband Association this year.
Yeah, that's something that you just announced,
Yeah,
right?
we have this wonderful initiative with Fiber Broadband is investing in our programming, and they're also helping us work with all of the ISPs around the country, the member organizations and companies that are in those communities that are already invested in your local community with the fiber connections that are being built. But in many cases, the anchor institutions, your local senior center, is often not online. Or if they are online, they're using a really dodgy internet connection and they're struggling. And so what we've done is we're now offering a package to local fiber entities to sponsor programming for older adults in their community, which allows us to build. It's as simple as, getting the fiber connection into the senior center or the service organization that's serving older adults in your community. And it might even, it could be a housing organization dedicated to older adult residents, but we need to put those connections in. Secondly, they need some kind of devices. We actually specify laptop carts or tablet carts, and then we spec them out for them so that they can get them at an affordable price. And then we'll go to those programs and train their local staff to teach our curriculum with professional development and professional support and data sharing. Nothing personal, but we want to know how many people did you serve. We measure net promoter score. Were the people satisfied with the program? Because when they get those trainings that are high quality, provided by a local trainer who they trust, with high quality connectivity that's provided by the local fiber broadband company, we now have the three-legged stool is now strong and people are learning and getting it. It's establishing people's user profiles and patterns, so now they know how to use it and why they might want it. So if you do subscribe in your home and you do go to the ISP and choose that ISP, you're already ready to use the technology. There's no unfair barrier to entry because you're old and nobody wants to train you. We're there right next to you, cheering people on and supporting them. So it's a really exciting program. We're pretty excited that we're going to get into dozens, maybe even hundreds of new communities through this program.
Wow, that sounds fantastic.
Yeah. It's
that's exciting stuff.
It's the best thing we have going on right now at OATS this year. I'm completely thrilled about it.
Oh, wow. I'm so happy that you were able to tell us about it here.
It's great.
So thank you for coming, and I hope we get to talk again.
I hope so too. I'll come back and talk to you about all the amazing success we're having with our Fiber Broadband Association
Yes, I want to hear about it.
Yeah, we've been having lots of meetings with Richard Williams and meeting with them and talking it out. They're such stars, by the way. I don't know that people get a chance to say this every day, but I work with a lot of partners around the country, both in the private sector, government, nonprofit, and working with the fiber companies and working with the Fiber Broadband Association. People are super curious and they're really innovative and entrepreneurial. I think part of it just because there's a lot of need to be, kind of doing projects with people and integrating, but it's been really refreshing for us. The door has been really open when we come in and try to do new stuff, and people are really willing to experiment with us, and we're really making a difference together. So
that's great.
I'm just happy to be doing it, and I'm looking forward to the next conversation we can report.
Yeah, we'll talk again.
Absolutely.
All right.
Thanks. That's
it for the FCTV podcast for now.